How can I explain animal-assisted therapy for PTSD to skeptics? Imagine a therapy approach that involves a furry friend by your side, helping you feel calmer and more connected. That's what animal-assisted therapy aims to do for those with post-traumatic stress disorder. To explain this to skeptics, it's important to relying on solid scientific evidence. Research shows that when people interact with animals, their bodies releases oxytocin, often called the bonding hormone. This chemical helps lower blood pressure, reduce stress hormones like cortisol, and foster feelings of safety and trust. These effects are measurable and consistent across different studies, not just feelings or opinions. PTSD symptoms like emotional numbness, hypervigilance, anxiety, and social withdrawal can be overwhelming. Animals can help in multiple ways. They offer unconditional acceptance, which helps rebuild trust. They act as social catalysts, encouraging interaction with others. And their physical presence can ground someone in the present, especially during flashbacks or intrusive thoughts. This isn't just speculation. Controlled studies have shown that animal-assisted therapy can significantly reduce PTSD symptoms. For example, some research reports anxiety decreases of between 21 and 65%. Depression scores also improve, with some veterans experiencing long-term relief lasting up to 3 months after therapy sessions. Dissociation, a common PTSD symptom, has also been shown to lessen in studies comparing therapy with and without animals. Of course, it's honest and necessary to acknowledge the limitations. Many studies have small sample sizes or different methods, making it hard to draw definitive conclusions. Some research shows promise, especially for short-term relief in veterans, but more large-scale, standardized studies are needed to establish clear protocols and cost-effectiveness. Being transparent about this actually makes your explanation more credible. It's also key to distinguish between what is well-established and what is still emerging. The evidence that animal-assisted therapy can reduce anxiety, depression, and PTSD symptoms is quite consistent. However, the exact biological mechanisms, like how animals help reduce dissociation or improve treatment adherence, are still being studied. Interestingly, research indicates that patients involved in animal-assisted therapy tend to attend more sessions and stick with their treatment plans longer, which can be a big advantage. It's important to emphasize that animal-assisted therapy is a complementary approach. It works alongside proven treatments like cognitive processing therapy, prolonged exposure, or medication, not instead of them. The goal is to enhance overall treatment outcomes by making therapy more engaging and less stressful. In terms of animals used, dogs and horses are the most studied in trauma treatment. Equine therapy, in particular, has shown promising results for trauma survivors. The type of animal, the training they receive, and how the therapy is structured all influence how effective it can be. For skeptics worried about placebo effects, studies have used validated assessment tools to measure outcomes. Participants show real, measurable improvements on standardized scales for PTSD, depression, and dissociation. When groups receiving animal-assisted therapy are compared to control groups without animals, the differences are significant, indicating that the benefits are not just in people's heads. Beyond symptom reduction, many participants report feeling safer, more accepted, and more motivated during sessions. They develop better problem-solving skills and confidence, which are vital for daily life. Since PTSD impacts daily functioning and relationships, these improvements matter just as much as symptom relief. While research on cost and accessibility is still developing, the existing evidence suggests that animal-assisted therapy can be a valuable addition to traditional treatments. More studies are needed to establish the best practices, training standards, and cost-effectiveness, but the potential benefits are promising. Finally, it's crucial to see animal-assisted therapy as part of a personalized treatment plan. PTSD is complex, and different people respond differently to various therapies. Some may find animals help them engage more fully in their recovery, while others may prefer other approaches. The key is having options backed by scientific research. The strongest point to share with skeptics is that animal-assisted therapy has moved from anecdotal stories to systematic research. Multiple studies show consistent positive outcomes, and the biological mechanisms involved are measurable. At the same time, being honest about where the evidence is still growing demonstrates scientific integrity. This balanced approach helps build trust and understanding. Remember, always encourage individuals to consult healthcare professionals for personalized advice. Animal-assisted therapy can be a helpful part of a comprehensive treatment plan, but it's not a standalone cure. It's one of many tools that, when used appropriately, can support healing and recovery from PTSD.